Welcome to Our Scars Speak. My name is Christina Miner. I'm the host of this podcast. And before we begin, we are coming here only to share some information and some education. We are not claiming to be your medical professional, giving any type of advice or suggestions that you should use. We definitely encourage everyone to stick to their treatment plan with their professionals. We are not being held liable for anything that is discussed here tonight. So without further ado, I am extremely excited about our guest tonight, which is Dr. Leslie Waltke. And I really still don't think she knows the impact she's had on my life, because when I was going through having surgeries and everything was just looking terrible on me, I really listened to all of her videos. And then on top of it, I reached out. And sometimes people don't reach back. And she did. And it's just been such a pleasure following you and giving me the information I needed to kind of calm me down. So I appreciate and let me know I wasn't going crazy when I was feeling certain things. So I thank you so much for all the work that you have done and are doing. I appreciate it.
And thank you, Christina, for the invitation to be there and for all what you do. It's a tough thing to go through. And some people just like, I'm done. I want to put it behind me. And other people are like, flipping, frazzling in the wind and don't know what to do. And other people just set their boots, lace up their laces and say, this is what I want to do. So I appreciate you doing this and appreciate the invitation to hang out with your people.
Thank you. So, I like to kind of just dive right on in. So before we begin talking about how you got into the medical field, who is Leslie? Without the titles and everything, just who are you?
I'm a boatload of fun. Well, I guess to strip it down to the bare bones, I guess I'm a 58-year-old woman. I am a native of Wisconsin. I live in Milwaukee, and we had a snowstorm yesterday already. Wow. I'm a mom, a stepmom, a grandma, I'm a wife. And I just I love cycling. I love hiking. I love the outdoors. I love, you'll hear my granddaughter in the background. That's enough. But actually I've got a grandson that's going to be born like within the next 24 hours, which is why my granddaughter's here. So, just really low key. Just love to be alive. And I love, my professional world and my personal world. There's just no way that you can, they just overcross so much. I do so much in the cancer survivor world, and in clinically that it just kind of, and I love both of my worlds, and it's nice that I can combine them. And I love, social media gets bashed because it's a microphone and people that shouldn't be using it can use it. But it's just a wonderful opportunity. I think it's one of the best things that's happened to healthcare in the last few years, because people can now be supported and communicate and teach and learn and you can have virtual support groups now, and stuff like this is really, really cool.
Yes, I love it. And you can just tell by even the pictures you gave me to put on your reel. I was like, wow, she really enjoys life. Like you can tell by every single picture, like you love life and you show it. And then also you can tell how the world's kind of intertwined with the marathons and stuff. So I was like, okay, this is nice. So what really led you into was medicine and then into the breast cancer community? We kind of want to hear about both, because I don't know if they're connected or if you have someone in your family who had cancer, but I just want you to share your story, how you got to become Dr. Leslie Waltke.
I went to college as a business major, actually.
Oh.
And, God forbid I did because God bless business majors, but I did a year of economics, a year of accounting, calculus, all that stuff. And I'm just like, because my family, it's just kind of the family thing, and then literally somebody in the dorm who was kind of an acquaintance, was acquaintance friend, just looked at me one day and said, why are you not in medical school? And I'm like, what? I mean, just was completely like getting hit with a brick. And I'm like, it was amazing that I often wonder what would have happened if she hadn't been standing there at that very second,
Right.
So I started flipping through, okay, if I'm going to go to medical school, what am I going to do? So I need to change my major. And then I was literally folding through a catalog, because this is back in the day. This was the early 80s when there was no computers yet. I literally through a book. I was literally through a book of majors, and there was a page that said physical therapy on it. I'm like, oh, talk about an Oprah light bulb moment. It was like, bam, I'm like, wow, that is what I'm supposed to do. And it literally meant picking up and going to a different college, which was tough because my people and my friends were all there. But it was automatic. It's what I know I needed to do for some reason. I had some physical trouble with my legs when I was younger. So I'd seen a physical therapist, and I just, honestly, I didn't feel like I was treated well enough. And I'm thinking, oh, I can do a better job than that. I know I can. So that's kind of how I got into the PT world, and then graduated with my bachelor's degree back in 1988 from the University of Wisconsin, and then went back and got my doctorate, which I earned in 2015, I believe, 14 or 15, from Rosalind Franklin University in Chicago. So there was a time when I treated ankles and shoulders and backs, and again, this was in the early 90s, and talk about, cancer just barging through the door.
Yeah.
My partner was diagnosed with breast cancer at the age of, God, she was just 21 or 22. We were literally a couple of kids. We were kids.
Wow.
Oh my God, I have stepchildren older than we were when she was diagnosed. And then at the age of 24, 25, was diagnosed with metastatic breast cancer, and lived only a year and a half. So she died at 25 and I was just 29. So it was everybody knows cancer is a shock. It's like, where did that come from? I can't believe this has happened. But at that age, it was just mind-boggling, beyond comprehension. And there was nobody in our peer group. Our parents weren't even with cancer yet, and our grandparents hadn't even died yet. So it was it was tough. It was really, I don't know, educational is not the right word, but life altering. And I think it was life damaging for a while. And I just didn't know. I didn't know what to do. I was so focused on caring for her, that when she died, I'm thinking, I have nothing left. What do I do? And I tried to go back to regular life, and it just was. So it took a while. I say it took a while, and excuse my language, but it took a while to go from pissed to passionate. It was almost 3 years. But what happened? And when somebody gets cancer, you guys know that all of a sudden 50 people that have cancer. Because you get everybody talking, and even at that young age, people started coming, and they were mostly young. And as a physical therapist, people would come to me and say, "Oh my God, this hurts, that hurts, this is stiff. I'm really fatigued. My feet are numb. What do I do? I'm trying to do this. Is that okay?" And I'm thinking, I don't know. I treat ankles and hips and shoulders, So at that point, I'm thinking, wow, this is what I'm supposed to do now. This is what I'm supposed to do. So I ended up taking time to study the physiological and functional effects of surgery, chemotherapy, radiation on the body, and then what do physical therapists do about it. And then it just kind of snowballed from there. And I started my little teeny practice in a little teeny corner of a community hospital, and they kept coming and they kept coming. And then I ended up opening, so I was helping that little corner of the city. And then I opened up a private practice. So just working with people with cancer. So then I was able to help really the entire community. And because it was an independent center, I could get patients from all the different hospitals. So I was kind of helping the entire community. And then I was recruited to a large health organization called Aurora Healthcare. And then I was able to really help the entire state of Wisconsin. And then I'm like, okay, I need to do bigger and more than that. So that's when I started the Recovery Room, which many of your people might be familiar with, which is a YouTube and Facebook channel, where now I literally have, tens of thousands of people, 40% of which are international. So it's just large, just stepping stones of being able to help more people, because I don't care where you are, where you're from, how old you are, what color your skin is, what country you live in. Cancer is such a universal experience in so many, it's so individualized and it's so universal that people in Pakistan, well, actually Pakistan is one of the top 10 countries that I reach, believe it or not. They're suffering from the same things that somebody here in the United States does. So it's just such a nice way, again, to be able to reach and help just from my back office. So it's pretty cool. So it's been an amazing journey. And I hate the word journey, but that's just kind of what it is. And then I have, and I think, so certainly I'm impacted by my cancer experience, kind of what got me into this. But now having worked with, I have most likely worked with more people with cancer than any other physical therapist on the planet. So I think that's why I can call myself one of the smartest physical therapists, because I've learned so much from the people that go through it. Because that's where I mean, yeah, you can go to school, you can open a textbook, you can go to an anatomy lab, but the experiences that I've learned from so many people that I've been able to take now and share that. Plus, I have, when I was 31, and I think, again, this is a huge impact on how I care for people and how I treat in the clinic. Who knew I have a congenital defect in my pancreas? Yeah, who knew? Until I was 31, it was like literally I went from normal to very sick, critically ill, had horrendous chronic fatigue for 6 years, was on a feeding tube for months. I literally filled out the DNR, do not resuscitate paperwork. And was really, really sick, had like 6 or 7 surgeries on my pancreas. So suffered a lot, was close to death, had my life threatened, was really sick for a really long time. And so I think, again, and thankfully was able to recover from that. That perspective too. So have literally seen life from both sides of the bed rail.
Absolutely.
Again, that perspective. I've never had cancer. People ask me that all the time. But again, I know so much just because I've done so much.
Yeah.
I've never heard myself. I've got basal cell carcinoma because I'm a white chick that grew up in the sun. Little German girl that grew up on the lake, and we didn't even know what sunscreen was back then. But I've never heard the words "you have cancer." So, but have really been very, very sick, and actually have been sicker, closer to death, and had more surgery and more pain than more fatigue than most of my patients have. So that also certainly kind of sets the frame of the passion that I have, because I know how crappy it is to feel crappy. It's really awful. So, and I teach people that unless you've had cancer related fatigue or medical related fatigue, you have no idea how devastating that is.
No idea. And then the trauma of it all.
Yeah. And the suddenness of it. I mean, it literally was somebody turned off a light switch. So it was just this sudden, like what? So the perspective is there that I think helps me reach people and drives me to make sure that while I'm here and while I'm working, to the opportunity to make sure that we help as many people as we can.
No, it makes a lot of sense now, because I used to work in the medical field, like I told you, but then also it's really interesting to identify individuals who work in medical field, mental health field, any field really, but definitely as far as medicine, you can tell those who came in passion driven and those who came in not so passion driven. But when you actually have that connection, whether it be through, like you said, someone that you cared for or yourself, regardless of what type of cancer or any other type of disease, it can make you have a passion for the person. And I think that's what it makes sense of. Now I see exactly why you reach so hard to contact me back and things of that nature, because you also know how it feels to be a patient who's going through something and maybe not understanding what you're going through or trying to decipher through it all. So, and then seeing your loved one, your partner go through at such a young age, when it wasn't talked about at that age, I'm sure not as much as it is now.
That was 30 years ago.
Yeah, that was a long time ago, because it's just now becoming like a thing, it seems like, where you hear more about it. And then we also have more testing that'll show it. So thank you for sharing that, because it all makes sense now. So with that being said, so you go through medical school and everything. And so I thank you for sharing that story. So let me ask you a question. As far as you call yourself cancer you're specialized in cancer physical therapy. Is there a separate school that you had to go for that, or special training for that? Or was it
special training? I mean, there's no magic bullet that, that says this physical therapist can do it, this physical therapist can't do it. So yes, I have spent decades working with other physical therapists who specialize in cancer care, and I teach to other physical therapists how to do cancer care. And you can get board certified, but you know, for people out there, you don't have to seek out somebody. You want a physical therapist, or you want an occupational therapist that has some experience in cancer. That's what you want. So you don't have to look for special certifications or anything. Just you want somebody that's had experience.
Okay. Yeah, I wanted to put that out there because I know sometimes people have gone to physical therapists that primarily works with like injuries, like to their knee or like you said, ankle, and then they didn't get the proper treatment they should for after having their surgeries. Yep. Speaking of which, so I'm gonna just kind of open the floor for you to share what you want to share for patients to kind of know what to expect like after reconstructive surgery, or whether they don't necessarily, well, there is reconstruction of aesthetic flat closure, they want to be flat, or whether they get implants or just had a lumpectomy. Can you just kind of elaborate a little bit about some things that maybe we need to be aware of? And I'll just let you have the floor on that.
The first thing I will say is, and this is important for people to hear, that with rare exception, after a breast cancer surgery, regardless of its flat reconstruction, regardless of the reconstruction type, or a partial mastectomy, with rare exception, people should expect to get back to 100% of comfort, 100% pain-free, 100% of tissue length, so their skin moves well enough that they can get their arm fully over their head. Their range of motion, their shoulders should be completely back to normal. Their strength should get back to normal. So I will say, if you, other than looking in the mirror, where you can see you probably maybe look a little bit different, you should not function any different. You should not feel like you have to limit or baby your arm or do anything. You should be completely back to normal. And I think that surprises people, but that's the way it should be. Because your surgeon's not repairing your knee or taking out a tendon or shaving a bone or repairing muscle. They're literally just taking tissue out, whether it's mastectomy or partial mastectomy. They're just taking out tissue out and then closing. So, if you have those kinds of surgeries, and some people go through surgery and have zero problems, and they're fine. And other people struggle with pain, limited range of motion, scar tissue, fibrosis from radiation. And that needs to be repaired and fixed by a PT. Because if you have that now, whether you're three weeks out, 3 months out, or 3 years out, or 30 years out, if you have it, it's going to stay there until you fix it. But if you fix that, again, with rare exception, you should be pain-free and fully functional and doing whatever you want to do without thinking about it. So if that's not happening for you, you need to get on the horn and call your physical therapist or call your cancer center or a local PT department. Just start looking around for somebody who can help you, because that should be the goal. Again, with rare exception, should somebody not be fully pain-free, fully flexible, fully strong. Okay. I think, again, the regardless of what reconstruction type you choose, or if you choose mastectomy or you choose partial mastectomy, if you get a choice, again, functionally, you should be absolutely fine. There should be no limitation in you long-term. So, and like a knee surgery or shoulder surgery or back surgery, you should go to PT. I don't understand why it just doesn't happen naturally. You have a stroke, you go to PT. Back, you go to PT. You have a knee replacement, you go to PT. So that should be happening with our people with cancer. So if you haven't had the opportunity to do that, it's never too late. You can always find things to improve post-surgically, even if it's 5-10 years. You will get better. Your tissues will get better. You will get stronger. So it's a matter of strengthening. Soft. Sometimes the PT has to actually put their hands on you and stretch and mobilize the tissue. Sometimes it's just a matter of showing you the correct stretches to do. And even if you've only had surgery and nothing else, every person that has a diagnosis of breast cancer, every person that has a diagnosis of cancer should be on an exercise prescription, which includes aerobic exercise, walking, dancing, bicycling, walking up and down the stairs, skating, whatever it is that you like, swimming. And so doing that most days of the week, five or 6 days a week. And then twice a week, strengthening arms and legs. Okay. So even if you've only had surgery, you should still be doing that stuff. Okay. Because it has been shown in the literature to reduce risk of breast cancer recurrence. Okay. So cancer survivors who exercise die less of cancer than cancer survivors that don't exercise. Cancer survivors that exercise die less of heart disease and diabetes and stroke and all the other crap that happens to people who are cancer survivors. So there is absolutely no reason why anybody that has cancer survivor after their name, whether you use the title or not, is not exercising regularly. And we could spend an hour talking just about exercise, but what I will say, please hold, is that people say, oh, I can't exercise. I'm not well enough. I'm too tired. I'm too weak. I got this. This is broken. That's broken. The sicker you are, the older you are, the more disabled you are, the more important it is to exercise. So the key is not exercising like you did 20 years ago. I can't do that. What it is the exercise that we want you to do on a daily basis is moderate for you for that particular day. Okay. Even people that are in treatment, we're making them exercise daily. So, and moderate from day to day can change. Some days I feel good. So moderate might be walking, 3 blocks. On days I don't feel well, moderate might be sitting at the edge of the bed. And just sitting upright can be moderate exercise for somebody who's really, really ill. So if you're breathing, you can exercise. Okay. Even if people are like, I was laying flat on my back, then you lift your arms up and down 10 times. You slide your foot up and down. So it's really redefining what exercise is for that particular person on that particular day, and what your moderate is. Okay. So that's the aerobic exercise component. And then we also have the strengthening components. The research again says that people should be strengthening their arms and their legs twice a week. Okay. So you can do that on the same day. You can do arms and legs on Tuesdays and Thursdays, or you can do arms on Mondays and Wednesdays and legs on Tuesdays and Saturdays. It absolutely does not matter. People get so hung up on what shoes am I going to wear? What weights am I going to use? Just do it. Just get it done. It doesn't have to be fancy. It doesn't have to be fast. I'm not some people are health club people. I am not a health club person. So I do all my stuff. I do it at home. I walk around the block. I have a little stationary bicycle downstairs. I use the wall to do push-ups, and there's just so much you can do right at home. And speaking of YouTube, my God, you can literally go on YouTube and say, give me 5 minutes of home exercise that's easy, or home exercises from a chair. So you can find stuff. Even if you are, really disabled either by life or body or by cancer, there's stuff on there that you can find, that you can certainly find to do. So regardless of stage of cancer, 0, 1, 2, 3, or 4, you should be exercising. The higher your stage, the more important it becomes. The older you are, the sicker you are. And again, if you are living with stage 4 cancer, exercise has been shown you're going to live longer. You're going to live better, live stronger, stay out of the hospital. Even people that are living with exercise actually decreases the risk of developing lymphedema. And for people that have lymphedema, they're lifting weights and running and jogging and lifting, exercising regularly, because that decreases the symptoms of lymphedema. So there's just no ifs, ands, or buts that exercise should be a part of your life. The other, and that will get a lot. Sorry. Okay, go ahead.
No, I was going to say that makes sense, because I know after I had my surgery, I was so bent on the day of surgery getting out of the bed, and everybody's looking at me crazy. And I was like, no. I was like, number one, I don't want to get a clot. I was like, I want to get out of here. And I did. I got up that day. I only got to the bathroom, but like you stated, which I think is so important that people need to hear, you're not telling people to go out here and run a marathon or do even 3 miles or 2 miles. You're saying do what you can do on the level in which you're at. And like that day, I was able to get to the bathroom, get back to the bed. The next day, I was able to get around the hospital floor, but I did increments. And so I think that's important because a lot of people hear, oh, exercise. Oh, you're saying I have to go out here and run and I have to lift 100 pounds. And it's like, no, that's not what you're saying at all.
I mean, if you want to and you can, more power to you.
Yeah, if you can.
Yeah, I've got patients that have black belts and are literally weightlifters, you know, and they compete. They're competing weightlifters, and I'm like, okay, let's work to do that. And other people, I'm like just little old Millie. I just need to get up and down the stairs and be able to take care of myself, and so I don't have to. So I can keep my independence. Well, then you really need to keep exercising, Millie. Otherwise, you're going to lose your independence.
Absolutely.
So,
absolutely.
The other excuse that will come up is I'm too busy. Life is busy. There's no question. I am incredibly busy. But there are 10,080 minutes in a week. You can find 150 to exercise, you know. And I'll say exercise is kind of like brushing your teeth. If you miss a couple days here and there, it's not going to, you know, by the time you're on your 80th birthday, it's not really going to make a big deal. But if you don't brush your teeth weeks, months, years, by the time you hit 80, you're going to have some issues. Okay.
Right.
Same exercise. So we all brush our teeth, right?
Right.
With pretty good consistency. And that's kind of the way we have to approach exercise. And the other thing I'll say is you did not have time for cancer. Just think about the excruciating amount of time that you spent on the phone with the insurance company, making appointments, nurse visits, physician visits, second opinions, blood work, the imaging scans, pathology, follow-ups, you know, pre-surgical events, post-surgery, you know, having surgery, all the post-surgery stuff, getting your port in, all the chemotherapy. I mean, just the thousands and thousands of hours that you put into that. You didn't have time for it, but you know what? You did. Why? Because your life depended on it.
Right.
So you have to approach then, I mean, humans need to exercise regularly to stay healthy. Completely lost touch with that concept over the last literally 50, 60 years. Because we have fun things like televisions and cars and that's all good stuff. But the planet, and it's not just us here in the United States, but we're getting bigger and we're getting more sedentary. And that is literally killing us. And we've gotten out of the habit of people just think, oh, you exercise because you want to be something extra.
Right.
No, you literally have to exercise to maintain physical health. And for the first time in the history of humanity, our life expectancy is going down, and it's embarrassing, people. It's really bad. It's bad. It's really, really bad. So when you were talking about just getting up and getting to the bathroom, just walking up and down the hallway, those little things are massively huge. So I would say that slow is better than no. Right. And something is always better than nothing. So on days when you've got nothing, I will tell myself, okay, I don't have a half an hour of energy, but I got 5. So I will literally walk up and down the stairs, or I'll go do my push-ups, or I'll sit to stand from a chair 10 times, or I'll just walk up, you know, hop on the treadmill and watch a 6-minute YouTube video. That is doable. But that's the approach that we need to take. Is exercise isn't extra. Exercise is brushing your teeth. Exercise is taking a shower. Exercise is putting on your clothes in the morning. It should be a natural part of general health. And we've lost sight of that. We need to get it back. And it's triply important for people with a history of cancer. It will literally impact how well you live, how long you live, and it can actually decrease the risk of your cancer coming back. And that's the whole point of doing treatment in the first place. You do treatment to decrease the risk of recurrence, right? Absolutely. So why would you go through that living hell and then not take the opportunity to do something that's free and it's good for you and it's fun? So exercise, again, has to be something that's doable, has to be something that you enjoy, and it has to be something that's accessible to you. If it's expensive or far away, humans are people that humans do not do things that we do not like.
Right. Not at all.
It's not going to happen. You know, there's a few people that can make them do stuff like that. But in general, make it something that you look forward to, that when you get done, you're like, you know what, that was okay. I think I would actually do that again tomorrow, or do it again on Thursday. That's what your exercise has got to do. So if that's not happening for you, you're doing something wrong. And
Yeah.
you are the boss of your own life. So you have to be the boss of your own exercise. So don't have other people tell you what you should and shouldn't be doing. You can certainly hire somebody to help you, give you suggestions. But you've got to pick for you what works best for you. Absolutely. Because otherwise, again, it's not going to be sustainable.
Right. And I think that's so good that you tell your patients that, because there's some physical therapists, like you go through physical therapy and they'll say, continue to stretch. And that's kind of it. They don't give you like the breakdown that you just gave. I did have one that did, but not everyone does that. So I thank you for that information for sure. So I know you stated that the pain, because I'm just curious, I know you stated that we shouldn't have pain. Like the whole goal is go through physical therapy, try to get your range of motion back and everything. But as you know, because I told you a little bit about my situation, scar tissue, I'm just curious, like, because sometimes, like you stated, if we didn't get stretched out possibly good enough, or something didn't, maybe, like, would we have to get surgery again, or could it really be fixed with the physical therapy? Because I know I've had pain, which I've told you about my situation. I've had pain repeatedly from the damage.
Yeah. So 95% of the time, pain post, as soon as you recover from the surgery, I think stuff's going to hurt. somebody just literally wrote the chest with
Absolutely.
Things are going to be sore. Things are stitched and you got drains and all that stuff. But once you're beyond that period, 95% of pain that people have will be from tightness, scar tissue, and weakness. Okay, which is why physical therapy almost always will help that for you. So, but the interesting thing is scar tissue is like slow setting cement. So let's say you're 4 to 6 weeks post surgery, you go through radiation, your movement is just stellar. It's completely normal. Okay. And that's wonderful, because most people should have normal range of motion within 4 to 6 weeks after their surgery. Again, if it's not normal, then you got to see somebody, because it's not normal to not be normal. That's nothing I'll say. But the catch is even with people that have perfect range of motion, whether it's just surgery or surgery plus radiation, which actually can compound things a little bit, because then you have scar tissue plus the fibrosis, because radiation can tighten the tissue, tighten the skin a little bit, is that scar tissue maturation process, or the radiation fibrosis maturation process, takes months. So it usually takes a year to a year and a half for that scar tissue to fully mature. And with time, it just slowly kind of just shrinks. People just get shrink wrapped. So I have people say, I feel like I've got an iron bra on, or I just feel like I've got tape around my chest, or I just feel like I get home and I take my bra off and I realize it already is off.
Or I don't even wear one.
Yeah. So, and that's a normal physiological process that happens in humans. Some people make a lot of scar tissue, some people make a little bit, but it's going to happen. And whether you feel it or not, but it may or may not impact you very much. But for people, so people can be totally normal 2 or 3 months after surgery, and then all of a sudden a year later, they're like, dang, it just, every time I reach now, I can feel it, and it's tight. And again, once that's there, it's going to stay there unless you stretch it out. And again, when you stretch, you don't get rid of the scar tissue. What you do is you lengthen the scar tissue, so you can reach and move better. And you also, if things kind of sticks, the layers can stick together. So whether you have reconstruction or radiation, or you have mastectomy, the layers can the skin can kind of stick to the breast tissue can kind of stick to the pec, the skin can stick to the pec. It just kind of gets stuck sometimes. And that can make it difficult to move. So if you're tight or you're stuck, there's a lot of nerve endings in there. So if you pull on that or you start moving, you're going to feel that, and your nerves are going to say, hey, this hurts. Okay. So, and that's going to stay there until you soften it and you lengthen it, which is why people that are, a couple years out, they still have pain. You're going to have that pain on your 85th birthday if you don't fix that. People will say, oh, it's not that bad, it's just kind of always there, it's not that big of a deal. It is a big deal. We don't want you to have that, because it does change behavior, it does limit mobility a little bit, and it's not good for your shoulder joint. We don't want you to end up with a rotator cuff problem in years. And that extra compression is not necessarily good for your lymphatic system, and it's not fair. You should be pain-free. So, so this is kind of a weird analogy, but if you take, so that scar tissue, slow setting cement kind of thing. So if you take a piece of Wonder Bread out of the bag, it is the floppiest, you just flop it and flip it and bolt fold it and twist it and turn it. You put your finger in it, it'll kind of, you make a dent and it'll bounce back.
Right.
You leave that piece of Wonder Bread on your counter, okay? You leave it there for a day. It's pretty much the same, but you leave it there for a week. You leave it there for a month. You leave it there for a year. What happens to that Wonder Bread? It's still Wonder Bread, but it gets thicker and tighter, and it doesn't happen instantaneously. It just happens slowly over time. And then you pick it up and it just doesn't bend. It doesn't flex. It doesn't compress. It doesn't, it doesn't lengthen. So that's kind of a weird analogy to how scar tissue happens.
Okay.
So people should be on a stretching program post-surgery, post-radiation for their entire chest wall. And then continue to do those stretches for about maybe 2 years post-surgery and radiation. And Christina, I can get you links because I've got recovery videos that describe those stretches and describe how long we can get the links for your audience for sure. But that's why I encourage people should stretch at least 1.5 years to 2 years after. Even if everything's great, you only maybe need to stretch once a week or twice. The tighter you are, the more often you should stretch. The less tight you are, the less you need to stretch. But eventually you should get to a point where things stop shrinking. You feel great, you stop stretching, and you're done. You're out of that shrink zone. So stretching is temporary, but the aerobic exercise and strength exercise is lifelong. Lifelong. And again, unfortunately, the studies show that most people again, the average human doesn't exercise enough. And even though exercise is more important for health for cancer survivors than the average population, cancer survivors exercise even less than the general population that's not exercising enough. So it's a really, really big problem. So, but again, unfortunately, people that do exercise during treatment, most of them tend to stop within 6 months of the end of treatment. And again, that's just not okay. So again, when I teach physical therapists, I really push them. You've got to keep in touch with your patients. You've got to make sure that they continue. You've got to find ways for them to sustain long-term exercise because it is literally life changing. And we can talk about aromatase inhibitor pain and neuropathy and all that stuff. I don't know where you want to go with this, but
I do have I have 2 questions. I do. So the first one, because I know you're going to talk about lymphedema also before we end. The first question is, far as going to physical therapy, what is usually the time frame after surgery to start physical therapy? And then also, do they need to wait till after radiation to start physical therapy? Because sometimes people have to have radiation. So I'm just curious, like, what is your time?
So ultimately, that's up to the patient and their healthcare provider. But generally, once the drains come out, you can start physical therapy. Okay. And even if your drains are in, and you're not going to PT yet, you should be walking. Your doctor should be telling you to walk already. Even with your drains, walking around the block and stuff. So once the drains come out, it's kind of the general zone of when to start PT post-operatively. Okay. And that's pretty typical for most people with breast cancer. Will go to PT after surgery. Okay. But again, the job of a physical therapist is to treat the musculoskeletal, muscle and bone, the cardiopulmonary, heart and lungs, skin issues, and functional issues. Like I can't get up and down the stairs. I can't drive a car. I can't get out of bed. I can't go back to my work. That's what we take care of. And what's important, again, for people who go through cancer need to understand too, is we all think post-op PT, surgery, physical therapy, but we don't understand that needs to follow through chemotherapy and radiation, and into survivorship. So you should have a relationship with your physical therapist that lasts for months or a year or more. All right. Because and even if people that have chemotherapy first, which is called neoadjuvant chemotherapy, those people should be in physical therapy before they even have through their neoadjuvant chemo, then surgery, then more PT, then if you have radiation. And again, everybody is so different and things are different. But in general, What we can't do in radiation is actually touch the chest wall. Once the skin starts to have a reaction, then hands off. But if we're working on balance because somebody has neuropathy from chemotherapy, you can still do that. If somebody's got cording in their arm or swelling in their arm, we can certainly be working on that stuff. Where their whole body is still fatigued and weak from chemotherapy, you can certainly work on that. So, and then again, people should be working with a physical therapist during chemotherapy and after chemotherapy.
Wow, that's
because
good
again,
information to know.
Yeah, because okay, again, we remember with physical therapists treat musculoskeletal, cardiopulmonary, functional problems, skin issues. So we know that surgery does that, which is why you go to PT. But chemotherapy causes fatigue, causes weakness, causes neuropathy, causes loss of function, causes heart function to come down. That's all physical therapy stuff. So it's important to have people so a good physical therapy program, a good cancer center will have a patient work with a physical therapist from beginning all the way through their treatment. Now, they're not coming in to see me every day or every week.
Right.
But my responsibility as a PT is to keep Mr. Smith or Mrs. Smith exercising during chemotherapy for breast cancer, whatever kind of cancer it is. Okay. And it's my job as a physical therapist to make sure that Mrs. Smith is ready for radiation when it starts. And that her arms move well, she can get up and off the table, that again, I want people to remember this, a couple of things, this on you remember this when we're done list, is the only evidence-based treatment for cancer-related fatigue is exercise.
I was about to say exercise.
Boom, it's the only evidence, but your physicians know that, your nurses know that. Sometimes that just doesn't translate to, let's get you to a physical therapist. But it is true. So again, inexcusable for somebody not to be exercising during cancer treatment. But it's hard to exercise, period, especially if you've never done it before.
Right.
And then you want me to do it while I'm in the middle of treatment. That definitely deserves somebody to help you, aka a physical therapist, to help you design, to progress your program when it needs to progress, and to regress. Okay, this week you have, you have cytoxin on Monday. So Wednesday, Thursday, Friday, you're not going to be walking around your 5 miles. We might have to just get to the mailbox and back. But then next week again, you're going to go up and down the stairs 10 times. You're going to do these step ups. You're going to sit to stand. You're going to do push-ups. So it's nice to have somebody help you and design programming for you, because it's hard to do that under normal circumstances, much less when you're going through cancer treatment. But again, the data are very clear that people should be exercising during treatment, because you lose less function and you recover much more quickly. Okay.
Sure.
And a nice analogy I'll use is that if because some people, I'm too traumatized, I'm too sick, too many doctor's appointments, I'm too busy. So let's say Mrs. Smith has a stroke. Okay. Her life is just in an instant gone from normal to catastrophic. She's stuck in a bed. She's freaked out. She's panicked. Lots of physicians, lots of doctors, lots of imaging, is just petrified, and lots of copays. Everything's very expensive. A physical therapist or a physician would not say to Mrs. Smith, you know what, you're kind of traumatized right now. You're pretty weak. You can't really get out of bed much. I know you're kind of sick. We'll send you a physical therapist in 3 to 6 months. That would never happen with somebody who's had a knee replacement or a stroke, or somebody who's had a car accident or lost a leg. There is a PT in that room right away. I'm sorry, things are rough, but we got to go. We got to get up and move. Right.
No, you're right. And I've worked in the hospital.
So why are we doing that to our people with cancer? We're like, letting you get trashed. We're literally letting you get trashed, get sicker and sicker, losing more function, getting weaker, getting sicker, losing more muscle mass, losing, cardiopulmonary status. It's when it can be, you shouldn't have to lose that in the first place. It's just very frustrating, which is another reason I get kind of uppity when I talk about this.
No. I appreciate this, because when you just said that, I thought back to when I worked in ICU and CCU, which is the cardiac care unit. And we got those jokers up as soon as they woke up. It was like, let's go. And then the cancer patients, we did not.
It doesn't make any sense. It makes no sense.
It could have. And the chemo was messing up their muscles and stuff. And then also, when you stated through chemo and through radiation, I hear a lot of us talking about PT after surgeries
Right.
but not necessarily after chemo and radiation. So
During and after. Yep.
here, this is just very it's frustrating because I've read some of the data that you're talking about,
Yep.
and that's why I've changed my whole changing even now things
Yep.
that I'm doing, and even we could go into nutrition area because I'm going more plant-based now, and I love the Blue Zone. I don't know if you've watched it, but I love that Netflix, and a lot of it was about exercise as well. But yeah, you're gonna have to. Oh my God, you're gonna have to come back. So, but yeah,
I'll talk your ear. You guys can tell I'll talk your ear off. So,
yeah, but
also,
you have,
we don't. A physical therapist does not have to rehabilitate what you don't lose. So don't lose. You can just maintain a. You're gonna probably, most people will probably lose a little bit. Chemo sucks. Radiation. It sucks. There's just no way around that. But when you exercise, you are going to be less weak, less nauseous, less sick. You're going to sleep better. You're going to have less pain. It's
mentally better.
I say you can be miserable or less miserable. That's a pretty crappy choice, but most people are going to say, I want to be less miserable. And I want to recover in 3 months, not a year. So, and those are choices that people want to get. Yeah.
Because mentally, even it helps you cognitively. It
helps
you. That's what I did. I walked all the time, and my sister is watching right now, and she was the one who really, like, when she went through getting a transplant, she walked all the time. And so when I got breast cancer, she came here and took care of me, and we walked every day. Every day I walked. I don't care if it was 500 feet or 3 miles. Like, I got out and I walked, and I still do it, and it helps. But if I don't exercise to go for a walk, my husband's like, when did you go for a walk today? Because my attitude changed. So I appreciate this. Oh, I appreciate this information. Yeah, you're gonna have to come back. But is there any way you can touch a little bit on about lymphedema, though?
Sure, absolutely. So there's two separate audiences: people that are at risk, okay,
right?
People that have lymphedema. So just when I'm saying stuff, it may make sure that you're in the right audience bucket that I'm talking about. So let's begin talking about people that are at risk. Okay. Now there's people who have sentinel lymph node biopsy only, okay, which is usually just 1 or 2 or 3, 4 lymph nodes removed. The risk isn't 0, but it's pretty low. So you're looking at a 4 or 5% lifetime risk of developing some swelling problems in your arm. Okay. People that have axillary dissections, 15, 25, 30 lymph nodes come out. Your risk is probably in the neighborhood of 15 to 20% over your lifetime of developing some. So risk is different for everybody. So you really need to talk with your particular surgeon about where am I on the risk zone? And they may not exactly know, but they can get just general ballpark area. Okay. So what and again, we need to spend an hour just talking about this, but what the evidence tells us for people at risk for lymphedema, the things to do to minimize risk, number 1 is minimize risk of getting an infection in that particular arm. Okay. So it doesn't mean don't garden, don't golf, don't sew. It means just if you scrape, scratch, burn, cut your skin, just keep it clean and covered until it heals. And if it doesn't look like it's healing correctly, or you look like you have some redness, you're going to call your surgeon's office or medical oncologist, say, my arm looks funky. They're going to give you an antibiotic to protect from infection, because the number 1 precipitator for lymphedema is getting an infection. Okay. So still do stuff, but just keep an eye on your skin. Number 2 is weight gain. Okay. And what happens to most people after breast cancer treatment is they gain weight. A lot of that's just changes in menopausal status, and sometimes it's treatment. So again, exercise will help minimize body mass index. If you are overweight, take time to slowly change your body mass index. And people, it doesn't take days or weeks. It takes years to remodel your body. So cut yourself some slack. Don't think you're going to do it in a month, because it ain't going to happen. Another topic, Christina. Okay.
Yeah, we definitely got to write
minimize risk of infection. Okay. Either do your best to maintain your body mass index if it's in the normal range. And if it's above that, try to, work with physical therapist, your physician, and probably a dietitian to slowly bring it down. It takes years. And then number 3 is we want you to make sure that all the skin in the chest wall, the underarm, and that your shoulder move completely normally. It has to be wonderful. I want it to not just be good, I want it to be great. So it moves completely normally, because the more your arm moves, the more your lymphatic system moves. All right. We want the range of motion normal. We want the strength in that arm to be normal. So because muscle contractions propel lymphatic fluid. So a stronger, more flexible arm is going to have a stronger, happier lymphatic system. So yes, pushing, pulling, lifting, carrying is not only safe for you after surgery, if you've been rehabilitated correctly, it's actually good for you. Okay. So people that are active and exercise have less lymphedema than people that sit on the couch. All right. So it's kind of a mental switch. Like, yes, I want you to push, pull, use, and carry. I want you to do repetitive exercise. I want you to push and use your muscles. And then finally, regular exercise, just routine aerobic exercise, strengthening. That 150-minute exercise prescription we talked about is actually reduces risk of lymphedema. All right. So those are all good things to do. Okay. Then for people that have lymphedema, the first thing we're going to do with you is check your strength, check your range of motion, check your tissue mobility. Because if that's not functioning normally, your lymphatic system doesn't really have a shot at doing the best it can. So people with lymphedema, again, stretching, strengthening, exercising is going to be a huge part of what we do. It may not cure the condition or eliminate it completely, but again, the studies show that people who are exercising with lymphedema have less variation in their symptoms and don't need as much treatment they have. And again, lymphedema should not hurt. With rare exception, people might get a little tightness in their fingers or tightness in their arm just from the swelling, but in general, they shouldn't have pain. So people have pain in their shoulder or their chest. That's not lymphedema. That's post-surgical or post-radiation stuff that hasn't been fixed. So I expect my patients eventually with lymphedema to be exercising, doing triathlons, biking, walking, swimming, pushing, pulling, gardening, doing everything they were doing before with 100% strength and 100% range of motion, and probably with some amount of swelling yet. Okay. But if you have a swollen arm, I expect you to live a full life with a swollen arm. And then how do you manage that? But again, all those good things that are healthy for you and your arm are actually going to benefit with lymphedema. So again, back in the day, people were told, don't do this, don't do that, whatever, because that's not true anymore. So so for some people around where we live, everybody knows that, but for somebody that's a really big paradigm shift, like, wait, what? It's exactly the opposite of what I've been told. Like, oh, you're not, whether you've had cancer or not, whether you've had cancer or whether you have lymphedema or not, you're not broken. People feel damaged or broken. I'm like, you're not damaged. You got a couple of kinks in the armor, but you're not broken. You're not damaged. And we just need to find ways for you to be healthy, to move, to exercise, and live your life to the fullest, the way you want to live. And that's my job, is to help you get there as quickly as possible and stay there.
Okay. And can they get it also in their chest wall?
Yep, absolutely. Mm-hmm.
Okay.
Yeah, the breast can swell. The breast can get lymphedema for sure. Yep. So if you've had a mastectomy and have a flat chest wall and there's swelling underneath, I would see your doc, because that might just be a pocket of fluid that they can drain. But you can get lymphedema in the breast. You can get kind of a fullness around the chest wall. And again, make sure that's just, sometimes surgeons leave extra skin. Extra skin is not necessarily lymphedema. So you can is that really swelling or is that just extra skin? And you can certainly get the swelling in the arm as well. So again, it's important to see somebody that kind of has an idea that works with lymphedema that can kind of help you through that.
Could they get sleeves from the physical therapist, or do you all refer them out to like the boutiques or something?
That's going to be depending on where you go. Okay. But I do want to say that there's so people, again, this is a conversation for people that are at risk for lymphedema, should not put a sleeve on their arm. They shouldn't put a sleeve on when they fly. That's still a really big myth that's out there. And they do not need to wear a sleeve when you're exercising. All right. I have patients who are cancer survivors for decades, pushing, pulling, lifting, carrying. I run a triathlon training program. Nobody wears a sleeve if they don't have lymphedema.
And those individuals with at risk, right?
Right. Yeah. Now, people with lymphedema, again, most of the time sleeves are overprescribed, and that's way too much conversation for just a minute or two.
No.
But I will say for people that have lymphedema, whether you're using a sleeve or not, is if you put the sleeve on and it gives you comfort, decreases your discomfort, or makes your swelling go down, then use it. But if you're wearing a sleeve just because somebody told you to, and you've been doing it for a long time and it does nothing for you, then it's doing nothing for you. And I don't know that you need to wear it.
Yeah. I mean, this is, everybody do what you want to do what your doctors tell you to do. But I know my doctor told me I didn't have to wear one. I had Sentinel. And I was like, but my physical therapist told me that I should get one,
Yeah.
and they did it. They got me one, and she said, well, you can wear it if you want to. I got on the plane and wore it, and I swole up by
Yeah.
wearing it.
Yeah.
And I took it off and rode back, and I was completely fine. And I was like, yeah, I'm done. And
Yeah.
that's not for everybody again, but it just, that was my experience. So,
Yeah. Right. And there's no evidence that actually air travel causes lymphedema. That's another myth. And there's no evidence that wearing a sleeve will prevent lymphedema. And we do know that people that prophylactically use a sleeve can actually cause hand swelling. Okay. So you're creating a swelling that wasn't even there before. So there is zero evidence, nor has there ever been evidence that actually wearing a sleeve when you fly. And I've been a PT, we're working in cancer care for 30 years. None of my patients ever have. Our physicians don't even say it. Nobody in Midwest has ever even, our patients have never even heard that. So we, even the blood pressure thing, there's no evidence that pressures cause, even needle sticks. Our physicians and medical teams don't even bring that up anymore. So
my doctor said I could still get it done, and I haven't had a problem. I know some people are like, well, their doctor said something totally different. They're scared.
It's always between you and your physician, but the evidence now, you're going to start to see shifts in the next years of it really doesn't matter. And if you want to use that arm, that's fine. Other people, sometimes their opposite arm, their quote unquote good arm, is trashed because they've been using it repetitively for years and their great veins are on their involved side. But again, if that's the data shows that you can use that. But again, that's always a decision. That's always your decision as a patient. And if you have questions, you need to talk to your physician, the one that's been in there. But in general, the data says does not increase your risk of getting, this is again for people at risk for lymphedema.
Yeah. Thank you so much. Oh my God. You're going to have to come back.
Slam in 60 minutes.
We're going to sit down, you and I, and make a list of some topics, because this has been, I appreciate it. Okay. Before you go though, you have to share the name of your song and who it was by and why you chose the song. And then after that, your work.
Okay. So I could give you a billion songs because I just love music. But I would have to tell you that the song that I think best for this it's called Glitter in the Air by Pink. And it's a thing I'll say to patients and survivors is don't just be alive, experience being alive. There's a difference. Don't just trudge through life because your heart is still beating. Experience the time you have. And that's what this song is about. It's about vulnerability. It's about kind of rechecking. It's the opening lines. Have you ever fed a lover with just your hands? Have you ever closed your eyes and just trusted? And then have you ever looked fear in the face and said, I just don't care? So it's about experiences, and it kind of looks at you like, have you had these things? Have you done this? Have you sat by the phone and just waited for it to ring? And if you have or haven't, I love the line is you're only half past oblivion. You always have more time. It's never over until it's over. So I just love it. I think it's very, very deep, and I love Pink. So it's pretty cool.
Yeah, I love Pink too. And your word, what's your one word that you can leave with people who are experiencing scars that they look at every day and it's very difficult, or mental scars, or maybe they just have new wounds, and something to encourage them with? And why would you choose
cancer
that?
Survivors, I will say, because again, I work with a lot of, I turn a lot of cancer survivors into triathletes, so they actually do swimming, biking, running.
Oh,
and the key I would leave with anyone is the word persistence. Persistence is your superpower. Because yes, you can get through surgery. Yes, you can get through chemotherapy. Yes, you can get through radiation, but life is just constantly throwing things at you. And you're always at the starting line of something new. And speed isn't going to get you to the finish line. Strength isn't going to get you always to the finish line, but persistence will. So I will tell my cancer survivors that persistence is your superpower. It's just a matter of sticking with it, trusting yourself, respecting yourself, treating yourself like you're the most important person on the planet, because you literally are. And you will exercise like your life depends on it, because it literally does. And to do things like that just takes persistence. It really does. When the harder things are, persistence is going to be your go-to. So.
Well, now I'm gonna leave you with something. And that is, you're just so passionate. And I also sense boldness with you.
Yeah.
I do. I sense that you, because we don't know you like that, but I just feel like in your environments, whether work or home, you're bold.
Yeah.
I can just tell by some of the things that you've said, some of the things that you've gone through. You are very bold. You don't take no for an answer if it needs to be yes. You're very, you're going to do what you can for the ones that you love, and that includes your patients and even people that you don't even know, like myself. That was on Facebook, and that's how I met you. So I just encourage you to continue to be the bold, passionate doctor that you are, and continue to just help us because we need your help. And I thank you 100% because you have, I hope I don't start crying. You have no idea how you really helped me. In the midst of being home and isolated in COVID and didn't get the proper treatment during my physical therapy, I could go and watch your videos and I could message you and you would send a message back. And that was comforting to know that I had someone in my corner who listened to me from that particular perspective. So I thank you for all your passion. I hate that you had to go through your own scars, mentally, and maybe even some physical scars in life because you hurt yourself before.
Yeah,
but
I got them. My scars are talking too, girlfriend.
Yeah, but you had to go through some mental scars, and I hate that you had to go through that with your partner and even some of your patients, I'm sure. But it led you to us, and I'm so grateful that it didn't happen just in vain. It happened because of a purpose, and I thank you for sharing that with us.
You're very welcome. I'm glad to be here, and people can find the recovery room on
where
and on YouTube. So yeah, where again, like and share all that crap that you're supposed to do. It's actually really a thing. It helps us grow. It helps us reach more people. Yes. So I would glad to have all your people hop over and
absolutely.
It's an honor to be here, and it doesn't help. It's no good to be passionate and bright and know all the right things to say if you don't have people listening to you. So I appreciate the opportunity to talk to your group.
Thank you so much. Well, that is another episode of Our Scars Speak. We thank you so much for watching us tonight. Remember that our scars, our mental, physical scars, speak a story. When you're supposed to tell that story, I have no idea, but it needs to be told when you feel led to share it because someone is depending on it. Remember that our mental and physical scars can help heal the wounds of another. Thank you all and have a great night, and we love you. Bye. I love the balloons.